training. So how do you apply GOATA in your practice?
Okay. Well, you look for the low-hanging fruit, like just like with the MDT assessment, you try to look for that, like get a concordance sign and try to find the biggest problem they have. Because the thing about GOATA that's a little bit more, MDT is very complex. I mean, we know it is. It sounds so simple, but it's really not. It's complex in a way that you're looking at a bunch of joints at once. So I'm trying to pick the one or two areas that movement issues that are the biggest problem. So like if you see their feet are really tired out, I would first work a lot on just get their feet straight inside ankle bone high walking. And so that's how I implement it. I'll do that. I'll do groundwork. So groundwork is the basis of how we develop. Like right now, I'm sitting in the floor. I'm sitting crisscross, but that in 𝐏𝐶𝐳, like where you sit on your feet, your toes turned under, not W sitting, but basically it's 𝐏𝐶𝐳. It's I can show you, but you can watch little kids. Do you have kids?
Not yet.
Well, but basically, you sit on your feet, your toes are tucked under, so that restores that ankle plantar flexion inversion, your knee range of motion, the torsion there at the knee, and also the hip interrotation. So many people lack that. You get them in the floor, they're screaming, and they cannot. A lot of them cannot extend their hip very well, and so that affects how well they walk if they're an athlete and they run. So this method, I use it every day in practice, and that's I'll target a joint or two, especially like the feet. I'll get on the ground, have them crawl. Once they learn how to crawl, they stop, how most people's thoracic spine gets so stiff and doesn't move well. That starts loosening up. They'll start moving side to side, and they got a little swag in their walker. They call it the GOATA wiggle. So yeah, that wiggle is huge. That wiggle's huge. I've still been doing it more than a year now, but I got home the other day. I was like, why is my left knee hurting? And I'd been riding and leaning more, and my right side was forward more. I'm like, I'm not getting my head over my right foot. I'm not pulling my right shoulder back. And sure enough, I started walking around the house. I'm like, oh, it's going away. So it's neat, and it's hard to treat yourself sometimes, but that's what the slow motion video helps you look at yourself too. So,
nice. Yeah. I read something about pressure wave on the patterns. I was looking at the website. So what is that?
Yeah, really, because I know it's podcast, it'd be easier to see it. But so pressure wave, I'll show you. I'll speak and I'll show you a picture while I'm speaking.
People can watch on the YouTube later.
Yeah, they can watch there.
To the podcast. I'll put on the YouTube so you can watch it.
But simply put, if you see pressure wave here, that you'll see when you load and you land on one side, that the foot will be straight, the inside ankle bone will be high. You'll see the knee go out 22.5 degrees in the sternum. So you can see that right there, like on Barry Sanders. Mm-hmm. So that knee is out, the chest is out. So that's that energy wave that you load on one side, and you load it and then you explode it to the other side. And so that's that energy wave, because energy doesn't typically move in a straight line. It's usually in waves. And so that's a lot of the theory behind it, is that our body may move in a straight line, but we are loading, and we're basically, you watch a baby crawl, they wiggle. And the good crawlers are the good runners and sprinters. You watch most of your running backs or sprint athletes, those guys, they've got some swag to them, and there's a reason why, because they're loading efficiently. I don't know if you've ever seen the video of Michael Johnson critiquing Usain Bolt. Guess what? Usain Bolt beat your record, dude. So you see him, you can see him load that. You can get on there, watch Usain Bolt slow motion. You can see him load that side, knee out, chest out, boom. And, he's even has a significant leg length discrepancy. He's still, set records. So that's what it's based off. People like that who move well.